Non-suppurative otitis media by ENT student. The competency is EN 4.5. Elicit, document, present a correct history, demonstrate and describe the clinical features, choose the correct investigations, and describe the principles of management of otitis media with effusion. Objectives of this are to describe the link between otitis media with effusion and acute suppurative otitis media, to notify the etiology of otitis media with effusion, to discuss the pathogenesis of OME, and to discuss the management of OME. This is the treatment protocol for acute suppurative otitis media. Antibacterial therapy should be given after diagnosis, and we should review the patient after 48 to 72 hours. In case there is earache and fever and there is persistence of earache or fever or there is any increase, another antibacterial therapy should be given continued for 10 days, or myringotomy should be performed, and culture and specificity for the antimicrobial should be done. In case there is a good response, we continue the same for 10 days. There can be complete resolution after continuation of antibiotic therapy, or it can still persist with fluid this time and earache and fever. Periodic checks should be done for 12 weeks, after which it may resolve without any effusion, or the effusion can persist, and then we will treat it as otitis media with effusion. Types are otitis media with effusion, adhesive otitis media, tympanosclerosis, and barotraumatic otitis media. Otitis media with effusion. It is defined as presence of serous or mucus effusion in middle ear cleft with no frank pus. Synonyms of otitis media with effusion are secretory or serous otitis media, seromucinous or exudative otitis media, catarrhal otitis media, or glue ear. Etiology of otitis media with effusion. There can be eustachian tube dysfunction. Vacuum in middle ear can cause extravasation of fluid. Lack of drainage of middle ear secretions can also cause otitis media with effusion. In case there are upper respiratory tract infections or allergies, they will increase the middle ear secretions. Low-grade middle ear infection can persist because of inadequate treatment of ASOM. Causes of eustachian tube dysfunction. First one is eustachian tube obstruction. Obstruction can be causing intrinsic edema, extrinsic edema, or functional obstruction. Intrinsic edema is caused by infection or allergy or trauma. Extrinsically outside the eustachian tube there is a obstruction which can be due to adenoid hypertrophy. Adenoid is a midline structure. So if there is adenoid hypertrophy, it will end up blocking both eustachian tubes. Bilateral obstruction of eustachian tubes is seen. Then nasopharyngeal tumor. Most common nasopharyngeal tumor is angiofibroma, benign tumor. Angiofibroma originates either on any one side. It is not a bilateral condition. So in nasopharyngeal tumor or angiofibromas, we usually see unilateral obstruction of eustachian tube. Post radiotherapy of any tumor, there can be scarring. Functionally, there can be floppy eustachian tube. Patulous eustachian tube will cause reflux of secretions. Others are palatal abnormalities such as cleft palate or palatal palsy. Then mucociliary pathology. In this, mucociliary pathology can be due to infection, allergy, or smoking. Then we have Cartagener's syndrome. It is a rare autosomal recessive genetic ciliary disorder comprising a triad of situs inversus, chronic sinusitis, and bronchiectasis. In Cartagener syndrome, there is defective movement of cilia leading to recurrent infections in chest, ENT, and infertility also. There is another syndrome called Young's syndrome. Now, Young's syndrome is also similar to Cartaginer, but in this there is thick and viscous mucus which is secreted in these people, which is a risk factor for developing pulmonary infections. Then we have surfactant deficiency or any immune deficiency syndromes. There is abnormal patency of eustachian tube, or there is obstruction causing narrowing of eustachian tube, or there is inflammation which is increasing secretions into the middle ear cavity, or there is a tumor or adenoids or any sort of structure which is growing outside eustachian tube which is pressing on it. Thank you.